Green line's on.
Oh, let me try this one.
What?
There we go, try it now.
Same thing? All right. Let's,
Okay, we're gonna do a little countdown, and then I'll do my little opening spiel, and then I'll introduce you, and we'll be ready to go.
all right.
Okay, everybody, we're gonna have a little countdown. 5, 4, 3, 2, 1. Good afternoon. Today is Tuesday, August the 6th. This is the Public Health and Safety Committee. We do not have a quorum, and so we are going to move forward with a presentation. And so we have, though, myself, we have council members Bradford, Huffman, Benton, Nash, and Prepty. Or actually, Prepty is not physically here in the room, so I'm going to mark him as absent temporarily, and I'll catch him when he comes back in. And then after we have our presentation, then we will move. We'll see where we are with quorum. We'll probably move to some department updates. And then lastly, we'll do legislation depending on where we are. Anybody have any questions before we start? Okay. So our presentation this afternoon, I had a really good meeting with MNPD's Captain Anthony Brooks, who is here with us today. There was a lot of conversation during the budget season about group violence intervention programs. And so Captain Brooks has generously offered his time to be able to kind of share a little bit more about what GVI means in relation to some of the programming that we funded in Davidson County, and then also kind of what that looks like with his department. And so with that, I will turn it over to Captain Brooks.
Thank you very much, and I appreciate you guys having me to talk about this. This conversation between Councilwoman Evans and I began, I believe, when there was an article that was released at some point that was detailing some of the grant money, the CVIPI grant that was issued to the city for different community violence intervention programs. In that article, it mentioned partnering with my office. I oversee the Office of Alternative Policing Strategies. And so there's a large chunk of money that is used for community violence intervention that is channeled through the health department. Now, the group violence portion is only a small portion of that grant. So that was some of the clarity that I was providing with Councilwoman Evans, because the health department is doing a lot of other things with a lot of other community organizations, and we're just a small portion of that violence intervention. Now, group violence intervention, I'll give you a little bit of background on where that started. This is not something that we have designed in Nashville. It is a program that has been existed and implemented in other cities across the nation and has seen some success. One of the earliest versions of it, I think probably because before it came to the full GVI model we know today, would have been Operation Ceasefire in the city of Boston. That might be some that you might have seen in the news in the 90s. There's been other cities that have obviously implemented programs like that. And it was sort of perfected in a model by John Jay College of Criminal Justice in New York. And we have actually reached out to them a few years back when we started the Office of Alternative Policing Strategies to consult with them on what we would need to install a significant group violence intervention program here in the city of Nashville. And so we work with consultants there, and I mentioned them because their work is important. And also, as you've seen some line items, I think in some budget for some contracts that go to them for consulting, and this is the reason. So one of the things that they did a few years ago when we first started, I believe this was in 2021, I was still just a baby lieutenant in the Office of Alternative Policing Strategies. And our office got together with a lot of our investigative units in Metro Nashville to review the previous 200 homicides and 100 non-fatal shootings going back over a couple of years in order to present that data to John Jay University. They sent consultants down here. We sat in a room for 3 days. We presented a lot of case information to them so that they could help us analyze some of our group problems. And now I'll go back a little bit to tell you why we're doing that. So the purpose of this group violence intervention is studies have shown that violent crime in most major cities, and Nashville is no different. The large amount of the violent crime in Nashville, I think the total from the studies we looked at shows almost 50% of the violent crime is perpetrated by such a small amount of the population, and that small amount of the population can be tied to certain groups. It's less than 1% of the population. And as I say group, you might be thinking gangs. We use the term group and not gang because all gangs are groups, but all groups are not gangs. A group could just be a group of individuals who grew up in the same neighborhood together, got on the wrong path, and they're now a robbery crew or doing violent crime. So we don't want to exclude anything like that. So when John Jay came in, the consultants from John Jay came in, we all sat in a room, presented a lot of this data, a lot of the intel about who we thought they might have associated with, and they helped us generate a report regarding the group activity in Nashville. And that number I just quoted, that was almost 50% of our violent crime, was perpetrated by, like, they narrowed it down to 14 violent groups in Nashville, and that represents like less than 0.5% of the population. So the idea behind the strategy is, and I'll give you a little analogy that I have stolen. I don't even know where I stole it from, but I don't have a lot of original thoughts of my own. I steal most of this. But, you know, historically, law enforcement have been lifeguards pulling people out of the river. And if you look at that river as like a life of violence or violence crime, we don't get involved until you're in the river. And then we pull you out of the river, which is arrest, incarceration, that sort of thing. And historically, we've kind of felt like whether we felt this way or not, we've not been going upstream to see why people are falling in the river. You know, whether we thought it was other people's job or not. But the idea behind police work and community policing has changed a little bit to where we realize if we're involved in a community, it's everybody's job. So the idea behind group violence intervention is if we've identified these individuals and we know that they're violent and we know they're involved in violent groups, why not reach out to them on the front end? Why not deliver a message that we need the violence to stop? If I delivered the message by myself as a police department employee and said, hey, we need the violence to stop, that's going to come with an or else, because police departments are designed to do a certain function, right? A crime is committed. We enforce the laws that are behind that crime. So the message is not that great if it only comes from me. So group violence intervention then becomes a partnership between other city government areas, like in our instance, the health department is involved. It becomes a partnership between community organizations in order to help us deliver that message. So the message is, hey, we know who you are. We know who you're involved with. We know the things you've done in the past, but we want it to stop. And if it doesn't, of course, there is that or else portion. The police department's going to do what the police department's designed to do. However, it would be an empty offer if we did not give you help in getting out of a life of violence. So we deliver our message, but here's some of our partners within the community. One of our main partners right now in GVI is the Urban League of Middle Tennessee. So we would turn that interaction over to the Urban League and just go, hey, you know, whatever you need to assist you to get out of that violent cycle, we've got resources for it, whether it be job placement, whether it be addiction services, counseling, anything that we can do to help. I mean, some cities have, we've not had to do this in Nashville yet, but I know some cities have relocated individuals because they wanted to be away from the influences in order to get their life back on track. So it's that sort of thing where like I said, police department has those partnerships in order to deliver those messages. And along with those messages, one key portion of group violence intervention that we have not been able to conduct here yet in Nashville is something called a call-in. So I mentioned that we identify a lot of individuals and names of individuals that we want to focus on to receive that message. Well, a call-in is simple that. We call them into a central location so that we can deliver that message en masse to like 10, 15 individuals. And we would have the police department up there delivering our side of it. We would have the service providers. There would also be a piece with what we call credible messengers, someone up there making a plea to end the violence. And this would be somebody whose family was affected by violent crime, whether they lost a child in a crime or as an innocent bystander, or it could be someone who was involved in a life of crime prior, spent a lot of time in prison and is coming out and can speak to that side of it, to make a plea from these individuals that we've identified. And so that would be something that would be done in mass. Well, the way we've been getting the message out so far here in Nashville without having our first call in yet is something that's called custom notifications, where as we have a list and we identify individuals that need to hear this message that we want to actually get plugged into to help them get to stop violence, is we will actually go visit them individually. We will take our partners with the Urban League, knock on doors, talk to them a little bit about how we can help them get out. And then the Urban League and our community partners in there will do some follow-ups and try to do some case management on that end. And that's an overall gist of the work that we're doing. As a part of that, one thing that we've done that we've been pretty excited about, because as I mentioned, we're not breaking new ground here in Nashville. We're taking a model that is that's already been implemented in other cities. One city that was implemented in was Miami. And one of my lieutenants and I had an opportunity to go down to Miami to shadow them for a few days and see the work that they were doing. Now, they did something that they actually did sort of develop on their own, that they called a walk-in one-stop. They do that because they have these places that are called one-stop service centers or something like that. One-stop's in the name, where someone can come in to, if they need jobs, if they need assistance with rent, if they need just whatever type of community service, it's all in one place, medical, whatever. And they would take these out into the community. They would get all these providers and they would go mobile and they'd go into communities that were affected by violence. So whereas the GVI model is focused more on the individuals committing the violence, Miami said, well, what if we did a little focus on the communities that are affected by the violence? We loved that idea. And so that's one thing that when we came back, the lieutenant that I was working with at the time that was overseeing some of the GVI stuff said, well, what if we did something like that? Not necessarily walking through neighborhoods, but if we can identify some places that have had a lot of violence recently, we can just go to those neighborhoods. And we've been picking apartment complexes. And so we've done 3 events where we'll go set up there and have one of my officers with someone with the Urban League go canvass, knock on doors, talk to people in the neighborhood, try to see how we can help them sort of take their neighborhood back. And that's been something we've been pretty excited about, working with the Urban League to actually get out there in those communities that have been affected by the violence. And we said we stole that, kind of adapted it to Nashville from something we learned in Miami. And so, I say all that to say that, as you know, I know that a lot of things about violence reduction will come across your agendas, and a lot of the times that comes with money, and this time in form of grants and things like that. So I wanted to be able to let everybody know what we were doing on that side. It's one thing to see. I know when you look at a violence intervention on paper, that sounds great, but you might not really know what all the work is involved behind that. And so that's just a little sort of a nutshell of the work that we're doing. We're still, we're not where I want to be. I think if you ask anybody that's working on it with me, we're not where we want to be. We're building and moving the ball forward, but we still have a lot of work to do to where we're showing some metrics, because I love data. I love my data. And as of right now, we're so new that we don't have a lot of collected data to show, like in other cities where they've decreased certain violent incidents by over 50%. One thing that I can say, that this is something I just learned, because as you do this type of work, it can be a little bit of frustrating, because sometimes you might not know the effect that you're having, especially on the police department side, because if we're working with community outreach partners, if we've delivered a message and then the case management is followed up on the civilian side, we may not ever hear. And I was at one of the community events that I recently mentioned, and one of the providers that was working with us was having a conversation about an individual who we had actually reached out to through a custom notification, who was working with their organization now to get plugged into some employment. And that was extremely exciting to me, because that was one of the first times since we started this work that I've actually been able to put a name with what we're doing, that someone actually listened to us and is like seeking a way to get back, out of that river, so to speak, so that we don't ever have to have contact with them in a negative manner anymore. So I'm hoping as we move forward in this work, we'll have more stories like that. I hope in a few months I can come back and share more of those stories, share some data, show where your investment in our programs is actually having an effect on the city, because we're really excited about that community outreach approach and those that we're partnering with. So.
Thank you, Captain Brooks. I've got a couple of questions just based on what you said. And so it sounds like one of your biggest challenges is kind of making that connection between the service providers that you're working with and, like, how frequently are you touching people versus a provider and the conversations that they're having. And it sounds very similar to kind of what the Office of Homeless Services has had to overcome in their history, is kind of bridging that gap between like metro government and providers. Does that sound accurate?
It is. It's, I think that's one of the challenges that I've found in my office and all the programs that we oversee, from Partners in Care to gun retrieval to all the things that we do, is when in police work, prior to starting alternative policing strategies and me taking that over, everyone that I used to work with worked with or for me. And it was a lot easier to make those connections and get the outcomes you wanted. But whenever it's you're dealing with multiple agencies, and it's not through any fault of anybody's, it's just that you're not all in the same house, and so you got to make sure that you're making those connections. We've also had one thing that has led to some of those challenges is just, as I mentioned, it's been 2021 was whenever we started this work, and since that time, there's been a lot of turnover in leadership in both sides, on the police department side and in the city side, because that was one of the Mayor Cooper's initiatives. He had some individuals in his office that moved on to other things. My predecessor retired before my promotion to taking over this. A lieutenant that I was working with on the ground of that got promoted and oversees our school safety division. So all these organizations have fluid movement, and it can make for a lot of unintentional starts and stuff. Definitely been some pumping of the brakes in situations that were outside of our control.
Yeah, that makes sense. And then when you were talking about focusing on apartment complexes, how do you make the decision to do some of the activities that you were describing? Is it based on recency of events, or is it based on some other data point that you all decide, like, we're going to go to an apartment complex and do kind of that group effort?
It's based on a recency. My office is constantly analyzing the crime trends, the crime data, and and I'll give you the first one we did, the one that we thought, all right, we're going to try this out, was at an apartment complex in North Nashville. And we picked that one because leading up to it, there had been multiple shootings inside that apartment complex that had come across our reports on a fairly daily basis. And I will say, I said I don't have data. This is more anecdotal, and I don't know what part we played in it. I'll pretend that we had a big part in it. But since we had the event, like, there was a huge slowdown in some of the violent activity there. Could it have just been that some of these cycles are exactly that? They're cyclical, and that it kind of played itself out? Could have, but to just say that it didn't. We saw a significant slowdown since we went into that particular one.
And is that something, like, as far as recency, a lot of times council members will see things on the news, and, depending on our relationships with our commanders, we may talk as a follow-up to a commander or community coordinator, that if we wanted to know, do you have a plan to go into, that particular area or community? Is that something that council members could reach out to you and talk to you about?
Absolutely. I'm willing to speak with anybody on that. You mentioned community meetings with precinct commanders. Anytime we're going into an area, we usually have touched base with that precinct commander to let them know what we'll be doing. I think in 2 of the 3, at least, the precinct commander of that particular precinct has actually joined us on the event, at least for a little bit. So that's, I say that to say there's more than one way to find out about those. You can contact our office or in a community meeting if you do ask about certain things. If we do have something planned through alternative policing, the precinct commander would probably know it and be able to speak about it as well.
Okay, very good. And then on the custom notifications process that you were describing, is that targeted towards a specific age group? Or really, could it also be youth that you're driving some of those activities around, or is it really for adults?
We started with, it's, the short answer is it's for everyone. It's for youth and adults. We started with adults simply because my office is small and there are challenges in dealing with juveniles. Obviously, if someone's over the age of 18, we can contact them. We don't need a lot of parental involvement, or we don't need any parental involvement if you're an adult. So we started out delivering those messages with an adult that's, kind of to figure out our process, also to figure out so our partners could figure out theirs. But I mean, I think we're all pretty aware that juvenile violent crime is a pretty serious issue in this city, so we can't ignore that segment of the population. So we have actually started branching out and working with our youth services division and looping them into some of the things that we're doing. And we have done a handful of custom notifications on juvenile offenders. As I mentioned, those bring their own challenges because, there's some confidentiality associated with juveniles. And then also we have to have parents there and involved in the delivering of the message. One thing that we've also tried to do to try to reach juveniles is a big issue, I think, with juveniles is who they're influenced by. So let's say that I can't get in touch with a parent, or I can't really contact that juvenile because you need parent involvement. But because of our intel, we know that they're running with a certain group. And in this group are several adult influences that have been involved in violent crimes with this juvenile. We can carry the message to that group influences. We can go to the adults that are surrounding this juvenile and deliver that message there. So, there's some creativity involved and some fluidity involved when you do start to deal with juvenile offenders. But like I said, however, the short answer is yes, we do with both juveniles and adults.
Okay, thank you for answering all my questions. I'm happy to recognize anybody on the committee who would like to ask a question. I see Councilmember Weiner. Hold on just a second. Why can I never find anybody's name? Councilmember Weiner.
Thank you so much. Appreciate your time being here. We really appreciate it. And hats off to everybody that's been out in Bellevue helping us over the last several months with the things that are going on. I have one quick question for you. I have been pretty diligent about being at the community meetings, and I just wondered when you would be able to come and share this information with the community. We've gotten bigger and bigger turnouts, obviously, at the community meetings over the last several months. And I think that this would be extraordinarily helpful.
I'd love to. If you want to extend me an invitation, I know that it's been a while. I know I have been out, this might have been over a year ago, Commander Kendall had invited me to one of the community, what do they call that group? I'm drawing a blank. But each precinct has it. And so I've spoken at different precincts about some of the work we're doing. I think back when I did that, it was less along these lines and more along the Partners in Care program, which I think everyone's aware of with. So I've made the rounds with the mental health circuit. So I'd be more than happy to make the rounds again with violence intervention.
I think this would be a big help, especially for the people that are coming, because several of the victims of some of the crimes have been in on the meetings. And I think it would be, extremely informative. And I'll actually give Commander Kendall a buzz and have him do that. That'll be great.
All right.
Thank you.
Yeah, I like Commander Kendall. He's a good friend of mine.
Yeah, me too.
Thank you, Chair
Community
Weiner.
Advisory Board, that's the word I was trying to think of. All right.
Councilmember Nash, you're recognized.
Thank you, Madam Chairman. I just first have to say how proud I am to have been associated with this police department. When we see the people that come up here and present for us so articulate, so knowledgeable about their area, whether it be the drug intervention program or this, and great presentation. The interventions that you speak of, we did that in East Precinct with a North 2nd Street drug intervention program that made some national reviews and the like. And we had great help from local pastors that provided the jobs, the backup for drug treatment. We had one go from the intervention directly to drug treatment, and beautiful family. We did get help from the DA's office because that program, to make a real long story short, it was North 2nd Street was notorious as an open-air drug market. And so if we spent about a year making undercover buys that were all filmed, so you couldn't deny that was you, DA's office made a determination about who we might be able to just intervene with and warn them, and those that were going to be arrested because of the history of violence. They didn't want them out afterwards. And we were successful at shutting down that market and reclaiming that neighborhood. People really felt strengthened once the arrests were made and the interventions were made. They could take back their neighborhood themselves. I remember one person telling me afterwards, yeah, we saw this girl walking on the street, and they said, we don't do that around here anymore. It really gave them ownership. So I want to encourage you to keep up with and look for those areas where you can really make a difference in a neighborhood. Drug enforcement, we used to run through the street and we'd arrest somebody every day, then someone would take their place, but we'd bang our chest and say, oh, we made a lot of arrests, but we didn't change the neighborhood. And this particular strategy really changed the neighborhood. So keep up the good work, and thank you for joining us.
Well, and to piggyback off that a little bit, your name came up in one of our meetings once with one of our service providers talking about just that. And I don't even know if you remember this, but I was a young East Precinct officer on the midnight shift when you took over as commander in 2007. Was that, or it was late 06? Yeah, I hadn't even been here a year yet, so I had no idea what I was doing. But that's how, so I remember North Second, because that's how far I go back.
He's grown a lot taller since then.
Thank you, Commander Nash. Anybody else on the committee have any questions? All right, I appreciate your time. Captain Brooks, thank you so much for coming today.
Thank you guys for having me.
We'll go ahead and move into our agenda. Since we do have a quorum now, we have added council members Gregg, Harrell, Sepulveda, Prepty, and Weiner. So we have a quorum. I'm going to put everything on consent. Does anybody have a need for any items to come off consent? Okay, well, I'm going to go ahead and read the captions, and I'll see if anybody has anything they need to come off before we vote. First item is item number 2, RS 2024-619 by Porterfield Evans and others, accepts the Healthy Start Initiative, eliminating racial ethnic disparities grant from the U.S. Department of Health and Human Services to the Metropolitan Board of Health to provide a variety of services in reducing infant mortality for pregnant and parenting women. Item number 3, RS 2024-620 by Porterfield and Evans, approves Amendment 1 to a grant from the U.S. Department of Health and Human Services to the Metropolitan Board of Health to provide for the prevention, surveillance, diagnosis, and treatment of HIV/AIDS, and to administer a Minority AIDS Initiative program. Item number 4, RS 2024-621, Porterfield Evans and others, accepts a grant from the Greater Nashville Regional Council to the Metropolitan Social Services Commission to provide nutrition services for older or disabled adults and transportation services for eligible persons. Item number 5, RS 2024-622, Porterfield Evans and Welsh, accepts a homeless management information system grant from the U.S. Department of Housing and Urban Development to the Office of Homeless Services to pay the software system vendor, purchase additional user licenses when needed, and continue integrating data from the Nashville Rescue Mission. Item number 6, RS 2024-623 by Porterfield and Evans, accepts a coordinated entry process grant from the U.S. Department of Housing and Urban Development to the Office of Homeless Services to support the work of coordinated entry through planning, implementation, process improvement, program evaluation, and community education. And then item number 7, RS 2024-626, Porterfield and Evans, approves an application for a Paul Coverdell Forensic Science Improvement Grant from the U.S. Department of Justice, Office of Justice Programs, Bureau of Justice Assistance to the Metropolitan Nashville Police Department. Does anyone have any item that needs to be removed from the consent agenda? Do I hear a motion? It's been moved and properly seconded. All those in favor of this consent agenda? Anyone opposed? Anyone not voting? All right, we recommend approval of our consent agenda. 10 in favor, 0 against, 0 not voting. Okay. I want to recognize representatives from the Community Review Board to come up to the podium to share about a report that they need community feedback on. And so if you could come to the podium and then introduce yourselves.
Hello, my name is Ansley Potter. I'm the lead research analyst for the Community Review Board.
And hello, I'm Dylan DePriest, the policy analyst for the Community Review Board.
I just want to say a couple words about our policy, which we are policy advisory report, which we are presenting to at the upcoming Community Review Board meeting on August 26th. For a while now, we've been working on a policy advisory report for MMPD drafting a standalone zero tolerance policy towards sexual assault and sexual harassment. The policy we've drafted is almost entirely based on policy recommendations from federal agencies such as the Department of Justice, other law enforcement agencies that already have such a standalone policy in place, like the Chicago Police Department, and from nonprofit research and advocacy organizations like the International Association of Chiefs of Police and In Violence Against Women International, both of which have published example policies to make it easier for law enforcement agencies to take on. This policy comes 4 years after Mayor John Cooper and the Policing Policy Commission called for MMPD to adopt a zero tolerance policy towards sexual misconduct and sexual assault in their 2020 report. It has been acknowledged on a national scale that police sexual misconduct is a nuanced and complex issue involving not only sexual harassment in the workplace, but also of sexually motivated police abuse of power and authority when interacting with community members and other citizens. As such, this multifaceted problem is not adequately addressed by pre-existing blanket harassment and discrimination policies, but deserves special consideration. We hosted a public forum yesterday evening to receive community feedback. And at the upcoming August Community Review Board meeting, we will present the draft for board approval. I want to thank Councilmember Evans for coming out last night to hear our presentation. And we hope that other council members will take an interest in this project as it serves to protect MMPD officers and other community members. And we believe it would also be beneficial to MMPD in terms of community trust, as well as helpful in their 30 by 30 initiative to recruit and retain a 30% female workforce by the year 2030. Thank you very much for your time.
Yeah, we would appreciate any feedback any of you have on the draft itself. We'll be happy to share it with anyone who's interested, and we'll be happy to share the final draft as well. And we really hope that, Nashville and you all support this, as we think it's very important. Thank you.
What's the best way for people to send in their feedback?
Yeah, so we have an email, just community@nashville.gov. that you can send feedback to. And we're also happy to share our work emails and business cards after too to anyone who's interested for some more direct communication with us.
All right. Thank you both very much for coming up and being recognized. I'll take any other departments. I'm sorry, is there a question? Councilmember Bradford, let me recognize you.
Thank you. Is there a place where the community members can review the draft so that they can provide their input?
Would you all like to answer?
Yes, so we don't have approval from the board yet for a final draft to be able to publish on our website, but any community members or groups that are interested in providing feedback, if they reach out to us directly, we are more than happy to share a draft with them that we can incorporate their feedback through.
Thank you. How about any other questions? Okay, I appreciate your time. Thank you very much.
Thank you.
Any other departments that need to share anything with the committee? Don't everybody run to the podium. Looks like everybody's very content in the back. So I'll just, in addition to, I'll give a little summary of my information then, my chair report. So in addition to the sexual assault policy, I also attended the community meeting with the CRB, Chief Drake, Mayor's office on the OPA complaint last week. In addition, I also have learned a couple things about Metro Health, and so Tom, you may want to correct me if I say anything wrong. The BWAC, which is the Behavioral Health Wellness Advisory Council, they had their last meeting last week on Election Day, and so the mayor's office is working to reappoint or appoint new members to the Behavioral Health Wellness Advisory Council. It'll be a smaller number of members, and there will be an executive order affiliated with that. And the Behavioral Health Wellness Advisory Council is very instrumental to making recommendations to the mayor's office about behavioral health policy. This is how we got, for instance, the opioid settlement process and several other things that were part of the BWAC. And so that'll be something that we'll be learning more about as time goes on. The Board of Health meets this coming Thursday, and I understand, and Tom, I'm looking at you, but I understand that you all have appointed an interim director to have some overlap with Dr. Wright. So do you want to speak on that at all?
Yes, ma'am. Madam Chairman, Tom Sharp from the Health Department. Dr. Wright asked the board, told the board a couple months ago he did not wish to renew his contract, which expires at the end of August. The board has promoted Dr. Joanna Shaw-Kaikai, who is an MD, and she's been with us for several years, and she will be the interim director until there's a national search that will be headed up by Metro HR, by Shannon Hall and her team.
And can you remind everybody what Dr. Kaikai's specialty has been at the health department and her work?
Well, she's a doctor, so we make her do a little bit of everything. She works a lot in TB, particularly, is her one of her primary focuses.
Okay, very good.
Yeah. Can I mention one thing?
Absolutely.
That was not the last meeting of the BWAC. That was just the last meeting of the BWAC as it is presently constituted.
Right, exactly.
Yeah.
Yes, thank you for that clarification. How about any questions for Mr. Sharp while he is present? Okay. Well, with that, if Deputy Chief Gilder, do you have anything you need to share with anybody? No? Okay. All right, I gave everybody a chance. Okay, I appreciate everybody's time. With that, we're adjourned.